care. This isn't about how many have signed up for Obamacare. Let the media chase that one number. We actually look at least three numbers. How many of these new enrollees are just that, new enrollees? In other words, how many didn't have health care coverage before? How many are young? And finally, and perhaps most importantly, and most crucial, how many have actually paid?
How many of those who have signed up have actually paid?
Well, we don't have those figures. When we do, we'll get them to you.
Betsy McCaughey says that is the one number the administration isn't reporting. And Betsy, you know why.
That's right, because it doesn't look good. Net, it appears as if there has been no increase in the number of people with private health plans after this long, extended open enrollment period. The administration says, and watch those weasel words, they say somewhere between 6 and 7 million people have selected a plan. But there's a big difference between selecting and paying.
All right, let's say between selecting and paying,
right.
and also how many are net new. In other words, didn't have insurance before.
We'll get to that
now.
too.
What do you think of that overall number? How many are new, clean, paying enrollees?
Well, first let's take paying, and it appears that in the federal exchanges, the most conservative guess is that 20% haven't paid, according to Goldman Sachs. It may be bigger than that. In some of the state exchanges, as many as a third or more haven't paid. On other state exchanges like Connecticut, 92% paid. So it varies tremendously. But the fact is a big chunk of people have selected a plan, but they haven't paid, so they're not really insured.
Now, if you and I were to do this going online to shop, let's go to Amazon.com.
Let's say choose.
Well, right. Sure, who doesn't? But you go to Amazon.com right. and you have your cart full, but you haven't checked out.
That's exactly what they've done.
They are still counting you as having purchased this.
Which is illegitimate, because, in fact, you may have shopped, but you haven't purchased, right? Now, how many of those were previously uninsured? McKinsey indicated that about a quarter of those who enrolled were previously uninsured. It may be slightly more now because as we get closer to the deadline, there's been a real big push to get those previously uninsured. But they've been offset by the number of people who lost.
Well, we're hearing there's been a
plans.
frenetic rush in the end here. Now, a lot of that could have to do with all you have to do is check off on a box and say that you tried and you're good enough to get an extension for another couple of weeks. But how many of those are just trying to avoid having to pay a penalty, and if they check off a box, I know they're going on the honor system.
Right.
You don't know
Nobody
whether they
knows
genuinely
what
want it.
Deadline really means, because the Secretary of Broken Promises, Kathleen Sebelius, says there's going to be no extension in the deadline, but now it looks like
there is. There's another couple of weeks. When you go up there,
or more. It could be forever and ever and ever. Right. We don't know how long they're going to string out.
How many
deadline.
uninsured are there in this country? About 45, 46 million?
There were 48 million when the president took office.
Right.
So they may have made a very tiny dent, but not very much of a dent in the number of people who have private health plans. Then you've got somewhere between 1 million and 1.5 million people who newly qualify for Medicaid because of the changes in the rules under Obamacare, and some number of kids who are on their parents' plans.
Bottom line, if I understand you rightly, what you're saying is that the whole purpose of this, upending our existing health care system to cover those who are uninsured, we'll still have about the same number of uninsured, to say nothing of the millions who've either had their private policies revoked or charged a lot more.
And don't forget, in addition to that conclusion, a large chunk of the people who have private health plans were paying for them themselves and are now getting them courtesy of John Q. Public because they've moved from their own private health plans.
And the ones who were changed, a lot of them are paying more, Betsy, right? I mean,
a lot are paying more, but a lot are also getting taxpayer-funded subsidies that they didn't get before.
It's a mess, Betsy.
That's right. It's a mess. And there's more mess to come. Big premium default crisis ahead. Young people particularly who bought into the president's rather misleading sales pitch.
We are going to get into that young lady, but thank you. She's been all over this before anyone I know. Meanwhile, the president's push to sign young people up, getting lots of laughs on SNL.